If you want to avoid degenerative discs, then there are several things that you can do that are in your control to stop it from happening. If you don't know who I am, my name is Will Harlow and I'm the Over-50s and Sciatica Specialist Physio here at HT Physio in Farnham. And in today's video, I'm going to reveal the 6 risk factors for degenerative discs, how to avoid them, and what to do instead to maintain the health of your discs in your 50s and beyond. So when we're talking about degenerative discs, what we're referring to is a problem that occurs in the discs in the spine. So this is the human spine here. These white bones are the vertebra, and then in between the vertebra, we've got the intervertebral discs. And these are basically tough outer shells of collagen fibers with a fluid center. They're flexible, so they allow the spine to bend and to twist. Now, the discs are very important. They provide nutrients to the vertebrae and they keep our movement fluid and healthy. So they have an incredibly important role in the spine. However, one of the problems with discs is they are prone to degeneration as we get older. Now, degenerative discs can be a problem for some people, and it's been shown in some areas of the literature that people with degenerative discs are more likely to experience lower back pain. There was a study by Brinjinsky et al. Basically, they showed that on an MRI scan, those who had degenerative discs were more likely to also be suffering from back pain than those who didn't. Now, it doesn't mean that everyone with degenerative discs gets lower back pain or sciatica. Far from it. Most of us do have some degree of disc degeneration, but it makes sense to try and minimize degenerative disc disease as much as we can, and in this video I'm going to show you how to do it. Now, before we dive into the tips, I just want to show you this diagram here, and this will give you a good outline of what degenerative discs looks like. So this here is a healthy intervertebral disc. You've got the vertebra here and the disc in the middle. You can see it's tall, it's filled with water, it's plump and it's flexible, and the fibers are in a good condition. And then this here is my depiction of what a degenerative disc might look like. So you can see it's actually thinner, it's not as tall, it's lost height, and that's because it's lost some of its water. The fibers have got little bits of wear and tear in them, so they are degenerating. And to some degree, this wear and tear process is normal, but if it gets to a certain point where there's not enough space between the vertebrae, that can cause stiffness, and sometimes that stiffness can lead to mechanical issues that can also lead to pain. It can also make sciatica more likely because the nerves live at the space between the vertebrae. So if that space is smaller, they're going to be more likely to get pinched. So one of the main questions we had about degenerative discs are they inherited from our parents, or are they developing as a result of lifestyle? Now, we've landed as a profession somewhere in the middle. We feel there are some genetic components, there are some things you cannot change, but there are also definitely some lifestyle factors that make degenerative discs more likely. So I'm going to give you all of the risk factors. Many of them you can change, some of them you can't. And then at the end, I'm going to give you some of my top tips for things you can do to avoid degenerative discs. So the first and the biggest risk factor for degenerative discs, as seen in the literature, is smoking. Now, those who smoked in a study that was done in Brazil showed a 3 times higher likelihood of having degenerative discs on MRI. Smoking increases inflammation, it slows down healing, it makes all of the cells in the body less able to regenerate, and that seems to have a knock-on effect on the discs. So those who smoke are 3 times more likely to develop degenerative discs. So the biggest thing you can do is to stop or avoid smoking. Now, the second biggest risk factor for degenerative discs is having a job that involves lots of lifting. Now, it isn't just lifting from the floor that tends to be the problem for degenerative discs. It also seems to be carrying very heavy packs on your back. Now, this has been shown in a couple of different studies, and you can find them below. In the Brazil study that I mentioned earlier, the researchers found that those who did manual jobs had a 2.5 times higher chance of developing degenerative discs. And in another study done on armed forces graduates, so people in the Army, the Navy, or the Air Force, they found that those with the most physical jobs, and basically those who are carrying the heavy packs on their bags, also had a higher rate of degenerative discs later in life than those who didn't. Now, this isn't a perfectly defined group of people. There are many people who do these jobs and they don't develop degenerative discs, and there is some discrepancy in the literature. But if you're carrying heavy weights on your back all the time, or you're lifting lots of things from the floor and twisting as well, that seems to increase the risk of developing degenerative discs later in life. So lifting with proper technique is very important, as is getting other people to help you if it's suitable for you to do so, and making sure you're not bending and twisting at the same time seems to be a good way to ensure that you don't suffer more injuries than you need to. Now, the third risk factor for degenerative discs seems to be a lack of physical activity. In the Brazil study that I mentioned earlier, people with low levels of physical activity had a 25% higher chance of developing degenerative discs later in life. So physical activity, far from wearing down the discs, it actually protects the discs. It helps them to remain healthy. It brings blood flow and nutrients to the discs, which keeps the tissues turning over, and is a great way to ensure that you have a minimized chance of developing this problem later. Now, the fourth risk factor for developing degenerative discs is type 2 diabetes. Now, diabetes is an issue with blood sugar control, so uncontrolled glucose levels within the blood because of a problem with insulin. Now, what high blood sugar does is it interferes with the processing of pretty much every cell in the body, and the discs are no exception. So if there's high blood sugar levels that are uncontrolled, that are left to run wild within the body, it means the cells within the discs cannot process and turn over as well as they should, which means probably that degenerative discs becomes more likely. And we see this in the literature. People with type 2 diabetes do have a higher risk of degenerative discs. Now, that brings me on to the fifth risk factor for degenerative discs, and that is a high BMI. So being overweight is also a risk factor. Now, this may also be linked with the type 2 diabetes. It might just be that people who are overweight are also more likely to have diabetes. But the obesity thing does make sense. If you've got more body weight, that's more force going through the spine, which means the discs have to deal with more. They have to deal with more axial loading and more shearing force, which means degeneration is probably more likely. Combine that with a high blood sugar, and it's probably not a good combination. So if you can avoid being overweight and you can keep your blood sugar in control, that is going to minimize the chances of degenerative discs later in life. Now, the sixth risk factor for degenerative discs, and this is unfortunately one that we can do nothing about, is age. And this is the most simple one to understand. The longer you live your life, the more likely you are to suffer degeneration to pretty much any joint in the body, and the discs are no different. As we go through life, we lift, we shift, we move, and some of these things are going to cause shearing force on the discs, which can cause degeneration over time. And in a study by Brzezinski, they showed that over 80% of people in their 80s had disc degeneration. It was pretty much almost everyone had it somewhere in their spine at that age. So if you're going through life, you get to your 70s and your 80s, there's a high chance you're going to get some degeneration, but you can minimize how much this interferes with your life if you do the right things. So those are the 6 risk factors. And what I'm going to do now is just discuss a couple of things that can help if you've developed degenerative discs, or if you want to make sure you don't develop them. These tips are going to be useful for you. So the biggest one that I help people with is to keep a mobile and healthy spine as much as you can. So make sure you have a full range of motion in bending forward, in leaning back if it's comfortable to do so, in going side to side, and in rotating. Keeping a nice healthy range of motion in these 6 movements is a great way to maintain the health of your spine. Another important thing is making sure the muscles around your spine and in your legs don't get too tight. Tight muscles like glutes, hamstrings, and quads, because they have attachments onto the pelvis, if they become tight, then they pull the pelvis underneath you, and that puts more stress on the spine. So making sure your lower legs are well stretched off is a great way to prevent degenerative discs. Exercise classes like yoga and Pilates are brilliant because they tick both of those boxes. They improve your spinal mobility and stop stiffness and tightness in your legs. Another thing is having a healthy diet, making sure you're getting plenty of omega-3, because that has been shown in some studies to help with disc healing and to slow down disc degeneration. Now, admittedly, those studies were done not in human models, but I think that having high omega-3 is probably no bad thing for many different reasons, including heart health. It's also important to maintain a healthy weight and to keep walking, keep exercising, try and get your 7,000 to 10,000 steps every day if it's comfortable to do so. If you enjoy using the gym, don't be scared of picking up weights, but make sure your technique is great. Weight training and resistance training is one of the best things you can do for health, and it will also help you in maintaining the health of your discs too. Staying hydrated makes sense, because when we're dehydrated, that most likely leads to the body drawing some of the water out from the discs. So making sure you stay hydrated is super important. And then watching your posture when you sit, when you stand, and when you walk, making sure you're not spending too much time in bad postures. We want to make sure that our posture is optimized for spinal health. And then finally, making sure you get plenty of sleep and you're allowing your body to recover after exercise is a great way to avoid injuries to the spine. So hopefully that all makes sense and you found this useful. If you have, please leave a comment below. And if you want to get more from me, you can pick up a copy of my book. It's called Thriving Beyond 50 and you can find it on Amazon using the link below. My goal with this is to help over 50s to maintain their mobility and live a pain-free life. So pick it up if you're interested. Anyway, thank you for watching and I look forward to speaking to you on the next video.